Hello there, this is Dr. Shahid Javery. I'm the medical director at the Vibra Hospital in Denver, which is part of our Vibra Healthcare campus, including our LTAC, our acute rehab facility, as well as our skilled nursing facility. This month I'd like to talk to you guys a little bit about heart disease, or coronary artery disease as it's known. Essentially, this is a situation where the arteries of the heart are blocked for whatever reason. I'll take a quick step back and talk to you a little bit about how the heart works and whatnot. To simplify things, the heart is basically a big ball of muscle. That's really all it is, with blood inside. The heart squeezes and blood goes to the rest of the body to supply the body with oxygen and nutrients. When the arteries that supply the heart get blocked with calcium or plaque, then part of that heart muscle can be injured or die. That makes the heart not pump as well, so blood can't get to the body. That's basically what a heart attack is, when part of the heart dies because the heart itself is not getting enough blood. So what are the symptoms of a heart attack? What happens in that situation? Well, basically a patient can get symptoms like chest pain or shortness of breath. They can get sweaty, or what we call diaphoresis. They can get nausea. We traditionally think about people that get pain down their left arm or pain into their jaw. Lots of things can cause symptoms like that, but heart conditions are obviously the most serious. If somebody is feeling symptoms like that, we encourage you to please go to your doctor or go to the emergency department as fast as possible to get that checked out. That can be a heart condition, it could be a lung issue, it could be bones, it could be something as simple as acid reflux. But we want to make sure that we're ruling out the bad things when you do have symptoms like that. Sometimes people that have other conditions like diabetes or people that have, or females, can sometimes have different symptoms than traditional heart attack symptoms. So we encourage you to get help and get that checked out if that does happen. So when someone gets in the hospital and they are diagnosed with a heart attack or with blocked arteries of the heart, what happens then? Well, typically you'll be seen by a cardiologist. Lots of tests will be done, including blood tests, an EKG, maybe an echocardiogram to look at how the heart is pumping. And then sometimes people get interventions after that. You can either have a cardiac catheterization, which basically means you're looking inside the arteries of the heart. The arteries can be opened up and you can put a stent in there. Sometimes if the heart disease is bad enough, you have to get a CABG, which basically means a bypass surgery, where we have to bypass those blocked arteries. After all those things have been fixed in the hospital, that's when a facility like Vibra can help out. We are really good at managing post-MI type cases, meaning sometimes people are on ventilators or breathing machines after having a big heart attack. Sometimes they make it through well, but just need extra rehabilitation and what we call cardiac rehab. Sometimes there's a wound after having a big heart surgery, and you have to get wound care. The Vibra campus is equipped to handle all those needs, all the way from the ICU level of care to the rehab level of care. Obviously, we don't want to get to that point, so what do we do to prevent that? Obviously, the simplest way to think about it is diet, exercise, and medications. We want to make sure we eat a clean diet as best as possible. Avoid fatty foods, sugar. We want to have a good, clean diet with lots of fruits and vegetables. And the biggest advice I'd give you is to stay active. Walk, move around. Whatever your body's able to do, do it. Get outside and move. We want to make sure that we keep our hearts nice, strong, and healthy, and obviously take your medications. We want to make sure we have good control of our blood pressure, good control of our diabetes, good control of any other medical conditions that we're dealing with to make sure our heart stays healthy, so we don't have to go to the hospital or end up in a facility to get that managed. Please see your doctors. Please take care of yourselves. Until next month, thank you for your time.